Hello students, and welcome back to the Medicinal Plants series of videos. Today we're going to continue by talking about the medicinal plants we can use in the treatment of musculoskeletal system pathologies. So expect to learn how plants like turmeric, ginger, and nettle can help us treat pathologies like arthritis and lower back pain. Hi, I am Tommy. I'm a human nutrition student and researcher at the university. What I do in this type of videos is to synthesize my classes so then I can explain and teach you the best and most valuable information you need to know. So let's begin this video by talking about what are the main pathologies of the musculoskeletal system. So, medicinal plants for musculoskeletal system pathologies. Rheumatic diseases affecting muscles and joints. Low back pain, sciatica, tendinitis, bruises and sprains. We have four mainly: the osteoarthritis, the arthritis, the low back pain and the sciatica. The osteoarthritis is a progressive degeneration and erosion of the articular cartilage. The arthritis is an inflammatory lesion of connective tissue. As you can see, there is a difference. One is an inflammation, the other one is a degeneration. Low back pain is an acute or chronic pain in the lumbar area. And the sciatica is a pain caused by the compression of the sciatic nerve in the lumbar spine. So one is specific to the nerve and the other one is more general to the area. Medicinal plants can help alleviate symptoms and improve the evolution of these pathologies. There are plants that have analgesic and anti-inflammatory properties. Some are revulsive and rubefacient, we will see them, contributing to controlling inflammation and pain. So let's take a look at the plants. Starting with the willow bark. The part we are going to use is of course the bark of young branches. It is used to treat febrile and flu states, moderate headaches and minor painful joint manifestations, and that's why we are using it. Active ingredients are phenolic erythrocytes derived from salicylic alcohol. Salicin acts as a prodrug, which is indeed the main active ingredient. Then from the salicin and the action of the microbiota, we can get the saligenin. And after an absorption and oxidation, we will get the salicylic acid, which is very similar to the acetyl salicylic acid, which is indeed an aspirin. So the action is analgesic, antipyretic and anti-inflammatory properties. Of course, adverse effects, possible hypersensitivity reactions and gastrointestinal disorders. Interactions with non-steroidal anti-inflammatory drugs, oral anticoagulants and platelet antiaggregants. So again, the synergism here. Contraindications: hypersensitivity to salicylates, active peptic ulcer, of course, and then, as always, pregnancy, lactation, and young children. Posology: 60 to 120 milligrams up to 240 of salicin a day, maximum 4 weeks in case of joint conditions. Then we have the Meadowsweet or Queen of the Meadow, which is this one right here. We use the flowering tops and flowers. It is used as coadjuvant treatment of the common cold and relief of mild joint pain. That's why we use it. The active ingredients are the flavonoids, tannins, essential oil rich in arenic derivatives, methyl salicylate, and oxygenated monoterpenes. Monoterpenes, 10 carbons, remember that. Actions: analgesic, anti-inflammatory, but also antimicrobial, antipyretic, astringent because of the tannins, and anticoagulant properties. Adverse effects: no one reported. Same as interactions. Contraindications: not recommended in patients with hypersensitivity to salicylates. Indeed, it's similar to this one right here. Posology: from 2.5 to 6 grams a day of flowers, or 2 to 18 grams a day of flowering tops, up to 4 weeks. And then we have the Harpagophytum, which is this one right here, also called the devil's claw. You can imagine why. But, of course, the carefully dried secondary roots, so these ones. It is used for the symptomatic relief of minor painful joint manifestations. The active ingredients are beta-monoterpene glucosides of the iridoid series, the apagoside in this case. Remember the iridoid series. But it also contains pentacyclic triterpenes, phytosterols and flavonoids. Action: analgesic and anti-inflammatory, but also spasmolytic, hypoglycemic, diuretic, appetizer eupeptic, which is to stimulate appetite, and cholagogue, which is indeed increasing the biliary secretion. Adverse effects, free of side effects, at the therapeutic doses. At higher doses, it may give gastrointestinal problems. Interactions with oral anticoagulants, platelet aggregants, and antiarrhythmics because of that synergism. Contraindications, peptic ulcer, gastritis, diarrhea, hypersensitivity to devil's claw, and also, of course, pregnancy, lactation, and children. Posology, from 2 to 5 grams a day of dried drug, and the minimum duration of the treatment of 2 to 3 months. Moving on, we have the other claw, the Uncaria tomentosa, or cat's claw. As you can see, it's this one right here. We use the bark of the trunk of woody liana, for example. It's useful in osteoarticular inflammatory processes. The active ingredients are derivatives of triterpenic acid and pentacyclic oxindole alkaloids. But it also has proanthocyanidins, flavonoids, and sterols. The actions, anti-inflammatory, of course, but also immune-stimulating, antiviral, antioxidant, and anti-cancer. Adverse effects at high doses can give digestive adverse reactions, such as gastralgia and gastritis, so gastric pain and gastric inflammation. Interactions, there is a lower absorption with H2 antihistamines, antacids, or proton pump inhibitors. Makes sense. It's also an enzymatic inhibitor of the cytochrome P450. Therefore, you have to be careful with it because it will increase the toxicity of a lot of drugs. Contraindications, peptic ulcer, gastritis, patients with autoimmune diseases, pregnancy, lactation, and children, as always. Posology, 250 to 1 gram with an oxindole alkaloid content more than 0.9%. And we have to take it together with the 3 main meals. Moving on, we have turmeric. Which part? The rhizome, of course. It is especially useful in osteoarthritis of the knee. The active ingredients it has are curcuminoids, especially the curcumin, in 3 to 5%. It also has essential oils, terpene carbides, sesquiterpene ketones, and polysaccharides. Action, of course, anti-inflammatory, but it's also choleretic, cholagogue, antioxidant, antimicrobial, and hypoglycemic, as well as neuroprotective. Adverse effects it may have include gastrointestinal disorders and increased risk of kidney stones. Interactions due to low absorption, there are some microsome forms that have been developed to improve its bioavailability. Indeed, what we do normally is to use black pepper to increase its absorption. Contraindications, no one reported. And posology from 1.5 to 3 grams a day of the drug. Curcumin dosage for arthritis must be between 1000 and 2000 milligrams a day, so 1 to 2 grams. Then we have the Boswellia serrata. We use the gum oleoresin from the trunk or branches dried at room temperature. It is useful in osteoarthritis, especially of the knee, and rheumatoid arthritis. So it's similar to the turmeric, osteoarthritis of the knee. Active ingredients, pentacyclic triterpene acids, especially beta-boswellic acid, keto-boswellic acid, and acetyl-keto-boswellic acid. Actions, anti-inflammatory, analgesic, and sedative properties. As you can see, the majority of these drugs are anti-inflammatory. Adverse effects, no one reported, same as interactions and contraindications. The posology is 250 to 1200 milligrams a day of dry extract. 3 doses, maximum 6 months of treatment. And now we talk about ginger. So, as you can see here, we use the rhizome. It is used in osteoarthritis and rheumatoid arthritis. The active ingredients it has are oleoresin, essential oil, sesquiterpenes, 15 carbons indeed, pungent substances, gingerols and shogols, and starch. The action it has, antiemetic, anti-inflammatory of course, antioxidant, gastric secretion stimulant, and hypoglycemic activity. Adverse effects, gastric discomfort, headache, and drowsiness. Interactions, no one reported. And the contraindications are in gastritis, peptic ulcer, and gastric reflux because of the actions, as you can see. Gastric secretion stimulant. And posology, no specific posology has been reported. Then we have to talk about the Nettle or Urtica dioica, which is this one right here. Here we use the leaves and aerial parts. It is used as a coadjuvant in rheumatic conditions. And the active ingredients it has are mainly flavonoids, mineral salts, chlorophyll of course, carotenoids, phenolic acids, and mucilages. And the leaf hairs, the urticans, also have acetylcholine, histamine, and serotonin. This one right here, the little hairs. The action is diuretic, anti-inflammatory, again, and hypoglycemic. The adverse effects it may have are gastrointestinal disorders and allergic reactions. And due to the urticant, the fresh leaf, itching, burning, dermatitis, and urticaria when in contact with the skin. Interactions and contraindications, no one reported. And the posology from 8 to 12 grams a day of the drug or equivalent preparation. And now we have to talk about rubefacient and revulsive plants. This is the ability to cause irritation and redness when applied to the skin. They act decongesting and deflating the internal tissues by attracting the blood that circulates through them to the skin. So the blood from the interior of the tissues goes to the skin. Here we can differentiate between rubefacient plants and revulsive. The rubefacient plants, they have a local hyperemia with redness and a feeling of warmth in the application area. These are essential oils such as turpentine, rosemary, peppermint, and cageput. Careful with essential oils, because especially in prolonged treatments, they can be neurotoxic. On the other hand, revulsive plants are more irritating and can cause even blisters or pustules, so be very careful with those. And these are, for example, the arnica flower, which contains sesquiterpene lactones, analgesic, anti-inflammatory, rubefacient, and mucosal irritant action. This one right here, the arnica. But also capsicum fruits, which contain capsaicinoids. They have analgesic, anti-inflammatory, rubefacient, and revulsive action. These ones right here. And both of these are used for the symptomatic treatment of muscular and rheumatic pains. Okay, this is it for this video. I hope you understood everything I said. If you didn't, there is a comment section down below. Don't forget to like, subscribe, and turn on the notifications so you get notified every time I upload a new video. If you find value in this video, please share it to your friends and family to spread this knowledge to them as well, and to give them the opportunity to learn something new today. Thank you so much for watching, and I will see you in the next one. Hope you enjoyed. Ciao!